Welcome to the GoalZero Toolbox Talk series. Today's Toolbox Talk. Benzene. General. Benzene is a clear, colorless liquid with a sweet, aromatic odor. Benzene evaporates quickly, dissolves only slightly in water, and is highly flammable. Industry uses benzene to make chemicals for styrofoam, plastics, resins, nylon, synthetic fibers, some types of rubber, lubricants, dyes, detergents, drugs, and pesticides. Employees will be provided with information and training concerning benzene at the time of initial assignment to a work area where benzene is present and at least annually thereafter if exposure is above the action level. How benzene is harmful. Benzene is primarily an inhalation hazard. The inhalation of high concentrations can affect central nervous system function. Aspiration of small amounts of liquid benzene immediately causes pulmonary edema and hemorrhaging of pulmonary tissue. Benzene is harmful, especially to the tissues that form blood cells. Brief exposure of 5 to 10 minutes to benzene in the air at very high levels can cause death. Exposure to benzene happens mostly from breathing contaminated air from industry, automobile exhaust, 20% of exposure, tobacco smoke, 50% of exposure, or gasoline fumes. Signs and symptoms of exposure. Direct skin contact with benzene may cause erythema, redness of the skin due to congestion of the capillaries. Repeated or prolonged contact may result in drying, scaling dermatitis, or the development of secondary skin infections. In addition, there is benzene absorption through the skin. The local effects of benzene vapor or liquid on the eye are slight. Effects of exposure. High levels of benzene can cause drowsiness, dizziness, rapid heart rate, headache, tremors, confusion, and unconsciousness. Breathing lower levels over a long period can harm blood cells and bone marrow, and cause cancer. Eating or drinking high levels of benzene can cause vomiting or irritation of the stomach, dizziness, sleepiness, convulsions, rapid heart rate, coma, and death. Protection. The permissible exposure limit, PEL, of 1 part of benzene per million parts of air, 1 part per million, for an 8-hour workday. If administrative and engineering controls are not feasible, personal protective equipment and clothing shall be worn where appropriate to prevent eye contact and limit dermal exposure to liquid benzene. Eye and face protection, boots, gloves, sleeves, and aprons. The use of personal protective equipment when and where appropriate will be ensured by supervisors. First aid procedures. Listed below are suggested actions to take in situations involving benzene exposure. Eye. Flush immediately with large amounts of water for 15 minutes. Seek medical attention immediately. Skin. Promptly wash with soap and water, removing any contaminated clothing. Seek medical attention immediately. Inhalation dash. Respiratory support. Seek medical attention immediately. Ingestion. Seek medical attention immediately. Medical surveillance. The company shall make available a medical surveillance program for employees who are or may be exposed to benzene at or above the action level 30 or more days per year, for employees who are or may be exposed to benzene at or above the PELs 10 or more days per year, and for employees who have been exposed to more than 10 parts per million of benzene for 30 or more days in a year before the effective date of the standard when employed by that company. Check your local legislation for the expectations of the company's medical surveillance program in that jurisdiction.